My name's Alyssa, I'm 18 and I've been living with type 1 diabetes for just over 3 years. Living with type 1 diabetes is hard because it's so unpredictable and it affects everything in your life. When I go hypo, I tend to have seizures, so it's quite hard to control sometimes. Even just going on the bus can be quite scary because something can happen and I won't have anyone with me. I manage my diabetes using an insulin pump and a CGM. I write a blog called Pumptastic Scot. It just shares my experiences of living with type 1 diabetes, just to get my experiences out there and hopefully help other people in the same situation as me. Well, recently I went into hospital for an operation on my foot. When I went into the hospital, I was surprised by how little knowledge the nurses had on insulin pumps and CGMs. They didn't know how to use them or what they were, even though they're widely used with type 1 diabetics now. I had breakfast at 7 o'clock because after that you had to fast, and I've been having trouble with my breakfast ratios. I kept dropping later in the afternoon, so I gave less insulin for it, but I noticed later on that my blood sugars were dropping, and I told the nurses, and it took them about 20 minutes to actually act on what I'd said. I was really anxious during that time because what if something had happened? I had gone hypo and I had a seizure. I didn't really have confidence that they knew what they were doing with me, and during that time I had to text my mum and ask her what to do because I wasn't sure that they were going to act in time. I was quite scared because, well, I don't like having seizures and it was heading that way. Yeah. After 20 minutes, they put a glucose drip in to control my blood sugar so I wouldn't go low again. And then loads of nurses and doctors came to talk to me to ask how my insulin pump and my CGM worked. And it was quite reassuring that they asked me that, but in a way it was nerve-wracking because it's quite hard to teach them all the knowledge you need to know in a 5-minute talk. When I came round from the anaesthetic, I got told that during the operation my CGM had given a false reading and said that my blood sugar was low, so the surgeon had to stop what he was doing and make sure that my blood sugars weren't low and that they could continue the operation. The operation was a success and the care I received was brilliant. The nurses made sure I was comfortable and they were asking me loads of questions about how to help me, but the lack of type 1 diabetes knowledge was shocking, and something could happen to me and they wouldn't have known what to do. The advice I give to people with diabetes going into hospital is don't be afraid to ask what you need. At the end of the day, it's your diabetes, not theirs. I know that doctors and nurses work really hard and they do a great job, but it'd be great if they had more knowledge on diabetes because a lot of people live with it and they probably are going to come across it at some point, so it'd be better if they had the knowledge. The patients can have more confidence in the care they receive.